The secret tunnel of creation. Definition: they are tortoise ducts which convey oocyte from the ovary to the uterus. Spermatozoa introduced into the vagina pass up into the uterus and from there into the uterine tubes. Fertilization usually takes place in the lateral part of the tube. Second, situation. These are situated in the free upper margin of the broad ligament of uterus. Third, dimensions. Each uterine tube is about 10 cm long. At the lateral end, the uterine tube opens into the peritoneal cavity through its abdominal ostium.
Subdivision: the lateral end of the uterine tube is shaped like a funnel and therefore called infundibulum. It bears a number of finger-like projections called femori, and it is called fimbriated end or lateral end. Second one is the part of the uterine tube medial to the infundibulum is called ampulla, and it is called thin wall, dilated and tortuous. Third one is the ampulla is about 4 mm in diameter. This is the site for the fertilization. Fourth one is the isthmus succeeds the ampulla. It is narrow, rounded, and cord-like. It is 2 to 3 centimeter of the tube. Fifth one is the uterine or intramural part of the tube is about 1 centimeter long and lie within the wall of the uterus.
Next point is course and relations. The isthmus and the adjoining part of the ampulla are directed posterolaterally in a horizontal plane near the lateral pelvic wall. The ampulla arches over the ovary and it is related to its anterior borders, its upper pole and its medial surface. The uterine tube lies in the upper free margin of the broad ligament of the uterus. The part of the broad ligament between the attachment of the mesoovarium and the uterine tube is known as mesosalpinx.
Blood supply. First, the uterine artery supplies approximately the medial two-thirds and the ovarian artery supplies the lateral one-third of the tube. Second, veins run parallel with the arteries and drain into the pampiniform plexus of ovary and into the uterine veins.
Another point is lymphatic drainage. The tubular lymphatics join the lymphatics from the ovary and drain with them into the lateral aortic and pre-aortic nodes. Next point is nerve supply. The uterine tubes supplied by the both sympathetic and parasympathetic nerves. Parasympathetic nerves from the pelvic splanchnic nerves S2 to S4 and sympathetic nerves originate from spinal segment T10 to L2. The last point is clinical anatomy. First, salpingitis. Inflammation of the uterine tube is called salpingitis. Second, sterility. Sterility is the permanent inability to have a child due to a man-made procedure such as tubectomy. It is done intentionally for family planning. Third, infertility. Infertility is the natural inability to conceive. It occurs due to natural or medical causes. Fourth, tubal pregnancy. Sometimes the fertilized ovum, instead of reaching the uterus, implants in the wall of the uterine tube and starts developing there. This condition is known as tubal pregnancy, a type of ectopic pregnancy. Fifth, tubectomy, a surgical procedure for female sterilization in which a segment of each uterine tube is removed or ligated. It is commonly done by laparoscopy for family planning.